Dennis McDermott, and I'm from Flinders University, and I head up the Poach Centres for Indigenous Health and Wellbeing. I'd like to pay my respects to the Aboriginal nations on whose land we are today. We're on the junction of about 4 separate nations.
Thank you. Can you tell us the burning health equity issue on your mind?
For Aboriginal and Torres Strait Islander people, it's simple. For me, it's incarceration. We are so overrepresented in jails, and the effects are not only on the people in jail, but their families and communities as well.
And what's your advice to policymakers? You can make it federal, state?
I think I'd like to give some advice to the Victorian government, who's just won an election, obviously, that there is a treaty process underway in Victoria. I want to commend them for that and make sure it has a good outcome, because a treaty is the way to go to improve health.
Fantastic, thank you. Hello, could you please tell us who you are?
Hello, my name is Catherine Brown-Young, and I'm a researcher at the Southgate Institute at Flinders University.
And what's the health equity issue on your mind?
Well, I think the burning issue for me now really is in the increase in wage inequality that we see in Australia. We know that the top 20% household income bracket are earning almost 5% or even more than the bottom 20%. And for those people in the bottom 20%, they really struggle to even meet the most basic cost of living needs. And this, of course, has impacts across a whole range of social determinants of health.
So what's your advice to policymakers?
Well, I would say to policymakers, really listen to the Change the Rule campaign that the unions have, and also look at, get behind the anti-poverty network, who are trying to increase income support for people.
Lovely, thank you. Hello, can you please introduce yourself and also tell us a bit about where we are and what we're doing here this week?
Hi, I'm Sharon Friel. I'm from the School of Regulation and Global Governance at the Australian National University. We are here in Bungendore this week to look at the work from the NHMRC Centre for Research Excellence and Health Equity, looking at issues of agenda setting, of policy formulation, of policy implementation and evaluation, and what does all of that mean, and how might we think about all of those things in relation to health inequities.
Fantastic. And is there a single health equity issue you'd like to point out?
One of the things, and it comes out very strongly in the CRE's work, is the unequal power in the decision-making processes within Australia and globally, and what that means in terms of the pursuit of private interests over public interest, and what we are trying to understand and certainly recommend is how we rebalance some of those power inequities.
So how can policymakers do that? What's your advice?
So my advice and particularly to federal government, is to be courageous. You have a mandate to transform the culture in which the political elites and in which the bureaucracy operates, that embeds a culture based on the public interest, not on private interests. And to do that, we actually need a very empowered public service. At the moment, it's been hollowed out. Those principles and those concerns about the public interest have been stripped away, not because the people within the public service don't want to do that, but because they've been actively discouraged from doing that. So let's get a bit courageous and transform the way that that's done.
Fantastic. And for people interested in following this conversation more, there's the hashtag SDOHFuture, Social Determinants of Health Future. So please follow that on Twitter today, and hopefully we'll have some more periscopes to come. Thank you very much for your time.